I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. I spent much of my career not only operating on the heart and lungs, but operating on the esophagus. And I wanted to talk to you briefly about gastroesophageal reflux disease, which is known as GERD, and its association with esophageal cancer, to hopefully scare you into taking action. Esophageal cancer is a dreaded disease with a poor prognosis, largely due to the advanced stage at which it typically presents. Although this is still a relatively uncommon cancer, it has been increasing in incidence over the past 50 years in the United States and in Western Europe. So what is GERD, you're probably asking yourself? Well, in the most general terms, it's a condition that develops when the reflux of stomach contents causes troublesome symptoms. The classic symptoms include heartburn and regurgitation. So regurgitation is defined as the perception of flow of reflux gastric contents into the mouth. People typically complain of tasting acidic material mixed with small amounts of undigested food. Other symptoms of GERD include dysphagia, which is difficulty swallowing, and atypical chest pain. The diagnosis of GERD can often be based on those clinical symptoms which we just discussed alone. But now the part that may save your life. The causal relationship between GERD and esophageal cancer has been clearly established. In other words, GERD leads to esophageal cancer much of the time. The reflux causes an irritation of the lower esophagus, leading to something which is called Barrett's esophagus. And this is a known precursor of esophageal adenocarcinoma and is thought to result from chronic GERD and genetically susceptible individuals. So when is endoscopy or passing the tube down your throat indicated? Well, it's indicated in patients with GERD who have alarm symptoms, which is difficulty swallowing, painful swallowing, weight loss, gastrointestinal bleeding, vomiting, or weight loss. Those who have an incomplete or no response to therapy with a proton pump inhibitor like omeprazole or Pepcid. Those with recurrent symptoms after an initial successful 8-week course of therapy, patients who are candidates for anti-reflux or weight loss surgery, or individuals who are at increased risk of Barrett's esophagus. So I hope you learned something tonight. I hope you take this seriously, and if you have symptoms, please go see a gastroenterologist or an esophageal surgeon. If you want more information, you can go to my website, www.paladinmds.com, and I hope you have a good evening, and thank you so much for listening. I hope you learned something. Thanks.